Yeah, I think that there's general consensus there are enough dollars in the system. The question is, how are we spending those dollars? I think that the best source of financing is reforming the tax treatment of health insurance. I think that today, the way the system works is if you receive health insurance through the place of work, you get unlimited tax relief. And we're giving the largest subsidies for private insurance to those who need them least. And people who don't have access to affordable coverage outside of at the place of work, they have to go out on their own. In many cases, that applies to Latinos who the employer-based system doesn't work well for them. They don't get any relief. And so I think what you do is you limit the amount of tax relief you get at the place of work, and you use that revenue to finance relief for Americans who the current employer-based system doesn't work too well for. And of course, you need things like state-based exchanges or other pooling mechanisms so that you can pool those risks and that they could have something like group coverage but have the added benefits of choice and portability.
Well, anytime you change the way taxes treat anything, a benefit, a piece of income, whatever it is, other things happen. It's like a machine where you push a button and something else happens. If you started to tax benefits, what would that do?
Well, what happens today is that because you have unlimited tax relief, people tend to buy more insurance, and on the margin, they buy insurance that is first dollar coverage, that has little cost sharing involved, and so that has fueled a lot of healthcare inflation and health insurance plans that cover everything and anything, all the new technologies, all the bells and whistles, and that we know isn't producing good health on the margin. We're not buying the right types of insurance, the right types of health care. And so that would start to place a limit at the margin to reduce those incentives. And the Congressional Budget Office and others have said that is part of the key to reducing health care costs. And the current proposals on the table are trying to reduce health care costs. They're just bending the cost curve in the wrong direction.